This is Dr. Joe DeStefano with Urgent Care 24/7. We're going to chat today about erectile dysfunction. Erectile dysfunction, I think, sometimes is a little bit misnomered. It's almost like total body dysfunction because erectile function in a male is a good indicator of their overall health status. So, in a way, medicine has got kind of lazy in the last 30 years. I mean, before the invention of Viagra and Cialis, if somebody had erectile dysfunction, there wasn't a lot of very good treatment for it. So if you wanted to help your patients, you had to try to get them healthier, or you had to address the primary cause of the erectile dysfunction. This meant that you looked at their hormone status. Did they have enough testosterone to perform sexually? Was their thyroid okay? You looked at whether they had vascular disease. Did they have a problem with their erectile function due to hardening of the arteries? I've often thought to myself, I've never smoked, but smoking must be really good because people will smoke until it compromises their ability to have sex. So that is an indicator that it's a pretty dang strong addiction. Cigarette smoking poisons your endothelium in your arteries. Your endothelium produces nitric oxide. Nitrous oxide is what helps you to get an erection. And these medications, such as Viagra and Cialis, they work by increasing nitrous oxide production. So there is the problem with smoking. Smoking poisons the endothelium. It makes it harder for your endothelium to make nitrous oxide. It also hardens and narrows the arteries, providing blood supply to the corpus callosum in the penis, and these things worsen erectile function. Also, in general, sex is an exercise. It is physical activity. If somebody is in poor physical condition, they're out of shape, they can't do 50 push-ups, they can't do 25 sit-ups, they can't walk a 12-minute mile, they're going to have problems with erectile function. Hitting the gym, swimming laps, hiking, walking, these are all things that need to be done as a complete holistic approach to treatment of erectile dysfunction. And they're basically are just good for the patient. Someone who is in better physical condition will perform better sexually. Another problem with erectile dysfunction is someone once said 90% of sex happens in the mind. So you have to consider mood disorders and depression. Is somebody having a severe depressive episode and they're having erectile dysfunction because they have lack of interest in sex due to a symptom of severe depression? So the psychologic aspect of erectile function must be considered. So whereas Viagra and these newer nitrous oxide releasing medications have been really a revolution in about the last 30 years in providing help with erectile dysfunction. Like so many things in medicine, there needs to be a more holistic approach to it. This is Dr. Joe DeStefano for Urgent Care 24/7. Life is 24/7, and so are we.